Today we're going to talk about 3 types of therapy for treating anxiety. When it comes to treating anxiety disorders, research has proven that therapy is the best form and the most effective form of treatment because unlike medication, it really gets to the root of your symptoms. The great news is that you have some options. I'm Angela Howard and I'm passionate about breaking the stigma of mental illness among fellow Christians. I'm here to help you live a more purposeful life in your relationship with God and with one another. Don't forget to subscribe to my YouTube channel so that you don't miss out on any of the upcoming content. The first type of therapy we're going to discuss is cognitive behavioral therapy. The foundation of CBT is that our thoughts and our perceptions inform the way that we feel and then in turn contribute to the way that we act and how our behavior plays out. So CBT can really help you to develop new skills and techniques for facing your anxiety. And as we talked about last week, you'll learn relaxation techniques such as the 5 senses method, and you'll uncover maybe some of that source of anxiety that has really been plaguing you, and you'll have an opportunity to look at that in a new way and form some new thought patterns. You can also cultivate problem-solving techniques that will help you to cope with a difficult situation that really can bring on anxiety in the first place. Number 2 is eye movement desensitization resolution. That's a mouthful, so we'll just shorten it to EMDR. This is recommended for treating anxiety for those who have suffered some kind of trauma in their lifetime. It involves recalling distressing memories while at the same time experiencing side-to-side eye movement or other sensory input. There's been some significant research that shows that it decreases PTSD symptoms in 78% of patients. So it's definitely something to look into. The third type of therapy is exposure therapy. A therapist might use just systematic desensitization to treat fear, anxiety, or other phobias. So this would be appropriate if you have anxiety around the fear of flying or the fear of heights. A typical patient would start out by learning some relaxation techniques, and then the therapist would slowly produce anxiety stimulus or stimulus relating to the fear that they are struggling with. So obviously there are many different types of therapies for treating anxiety, but the good news is that there really is hope. Things do not have to stay the way that they are today, and you are able to press on and keep looking for that treatment that is going to work for you. Because really we've found that the best outcomes are through therapy. Philippians 4:8 says, "Finally, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things." So what types of therapy have helped you face your anxiety? Comment below, I'd love to hear from you, and don't forget to subscribe to my YouTube channel so that you don't miss out on any of the upcoming videos. I'll be sharing some great tips and encouragement whether you're struggling with mental illness or have a loved one who does. I'll see you next time.